Now we look
Is it
right.
better now?
That's better.
We look right to us.
That's
Let's
better.
see if your
All right.
comments are coming up correctly.
All right. I gotta make a few changes. I'm sorry. We'll flip us around. Make it a little bit brighter. There we go.
Wow. Look
Now-
how white I look.
You are Anglo for sure.
It's because I'm holier than you
Aha!
are.
There we are.
All right. I
All right.
still look very white and pale. I am still getting my vitamin D, so don't worry.
It is bright. Okay. So, did you guys have a good week? This is part 3 of our... there we go.
Okay. I'm trying to get mine pulled up, too, so I can see your comments.
We did it.
Okay.
All right.
All right. We are back, and there you guys are. Okay. So, oops, let me turn this down. So, let's do our introductions. Most of you know us, but maybe there's a couple of people who don't. My name is Holly Hajaj. This is not actually my show. This is Dr. G's show.
G-Show. She's just the boss.
Dr. G and the A-boss. I'm a boss. I work
A-boss?
as the corporate wellness director at the YMCA, so I help companies create and manage wellness programs. And then also we support those employees individually. We do lots of different things, challenges and lunch and learns and things like that. So Dr. G and I have been doing this lunch and learn. We should call it dinner and learn.
Hey, now
Supper.
I'm you.
Supper. So at least I got to say my name first this time.
Now, what was it? It's Holly Hajaj.
I'm not even going to acknowledge that. Do you want to introduce yourself?
All right, so I'm Dr. G, right? G-Money?
You don't have to say it that way.
All right.
I'm saying that to the audience.
Okay. So I do functional lifestyle medicine, as you guys know, and I'm in Wichita, Kansas, but I see patients all around the world, which is kind of humbling, but I do basically kind of helping people that haven't figured out where to get help from other places. And a lot of it, what we do is kind of food as medicine, just chemicals, balance out your hormones, and then people just get better and they feel normal. So when we talk about things like heart disease, it's that same concept where really it's decomplicating heart disease and saying what really causes it, which is lifestyle stuff, and how to reverse it, which is kind of like every
also lifestyle stuff.
episode for the last 105 or 6 shows.
Yeah. With that in mind, so yeah, our first talk we talked about did you already go over that? Our first talk we talked about what heart disease is, kind of defined it. You can go back in the talks too if you're just getting to this talk for the first time and haven't seen the last 2. So 2 talks ago we talked about what heart disease is. We went through some of your numbers like triglycerides and blood sugar and stuff like that, kind of what those mean and how you can attend to those. Then in the next talk, Dr. G kind of took over last week, talked about the stats and talked about lots of different ways, nutritionally especially, to make differences with your cardiac risk.
Yeah.
Today we're going to talk about the myths.
Wait, I thought we were going to finish my research. You hate that I have all this research and you squelch the research.
I don't squelch
It's
it.
part of some agenda you got going on?
This is, no.
You're anti-science, aren't you?
No, I love science. What I don't like is overwhelming the audience.
Science will post on Facebook that it's only in a relationship.
So I like to give people brain breaks so that they can assimilate the information. They can take it in. They can process it. So, okay, so we are going to finish with Dr. G's stuff and then just his stuff. And then we'll talk about myths. But we do also want this talk to be about you.
Oh,
so
that's a good idea.
We would like for you to please ask questions.
Yeah.
For
unless they're hard
this
questions.
Your specific questions. We plan to have more time to discuss those. So what are your questions about heart disease? This is part 3. So if we didn't answer anything for you before, or there's something you're struggling with, type those in. The other question I have for you is, what went well for you last week?
You asking me?
No.
So I went for a good... Oh, you're asking them?
You can...
That's a good idea. We should... All right, let's roll with that.
What went well for you last week?
Yeah, what went well for you last week?
Is it asking you?
Oh, me?
Thank you, Amy. Look at Amy's compliments. She does like your stethoscope over brown t-shirt look.
See, if you wear a t-shirt as a doctor, but you throw a stethoscope over it, you're dressed appropriate for work.
No matter what.
Right.
It's going to be a wife beater next week.
Well, I'll just drink some Stella Artois with it.
Thank you for the glasses compliment, Amy.
Yeah, I just got these. It's so good.
So what's going well for you guys? Have you started to try to implement some lifestyle changes?
Yeah.
Since the last talk? It was great to see some of your success stories from last week, just in terms of going to the gym and trying out new things. I know one person said they started walking to the mailbox. So those were some of the exercise successes. What has gone well for you this last week? Please let us know. Ask us your questions about cardiac disease. And I'm going to let you take it away from here.
I gotta talk about research?
I'm giving you the green light.
I'm so excited. I forgot my papers.
If he gets overexcited and starts spouting a bunch of jargon, please
you gotta say bring
speak
it down.
up.
Right?
Bring it down. Not about just slow it down.
At
they
church,
can understand the material.
At church, when the pastor's too long, you're supposed to bring it on in, bring it home.
Bring it home.
Right? They do that at your church?
No.
Oh. It's a Southern Baptist thing. So, if I speak too much medicalese, then you gotta just be like...
Simmer down.
Simmer down. Alright. So, we talked last week about clot-busting foods. And can anybody... So, these are foods that are just as effective as that aspirin without killing your kidneys. Which aspirin, ibuprofen, leading cause of kidney failure in the U.S. So what foods, if you guys remember, post the ones that are the most clot-busting foods that you could eat in your diet.
Clot-busting foods. No cheating. But we wouldn't know if you were cheating anyway, so you can cheat if you want. Clot-busting foods. Can anybody name one clot-busting food? Omega-3s.
That's not a food. Oh,
whoa.
Amy, come
that
on
was
now.
a bit sassy, Amy. I'm really sorry for that.
No, that's not a food, though.
No, not the research. How about this?
No, you are not cutting out the research. I'm starting. So, you guys post those. So, Amy, what's some omega-3 rich foods? Mm-hmm.
Omega-3 rich foods. Okay, mister.
I'm getting in trouble now.
Yes.
Yeah, so fish, cod liver oil. You can just eat those cod livers fresh. That's what I like to do. Pickled cod liver. No, okay, that's not true. All right, so we talked about. Did we talk about that? I don't know. What? Blood pressure. So we're going to talk about blood pressure cutting foods.
Did you want to talk about any of the other clot busting foods?
I already talked about all those.
All right. Well, you were just asking the quiz question. So. Yeah,
so they got to answer. So the ones that we said tuna, so that's what Amy's saying, right? 1 6-ounce can of tuna was as effective as 1 ibuprofen and 1 aspirin for clot busting. Cornell did that. Universities said red wine, green tea, fruits and vegetables, chili pepper, like spicy chili peppers, clove, ginger, cumin, and turmeric were actually stronger than aspirin for busting clots.
All right.
So, and then, so blood pressure reducing foods, wild caught fish, veggies, olive oil, high potassium rich foods. And with blood pressure, we used to say that, or not me, they used to say, avocado's a good potassium food. that salt was what causes hypertension, and so then everybody stopped eating salt. And then they came back and was like, whoa, you need salt because of sodium potassium pumps in your body. And what it ended up is that the excess of sodium is really from processed foods, which have about 80% more salt in them, so that they have longer shelf life, so they're more profitable for you. But research actually showed that it was low potassium that was a greater indicator for hypertension. Now, one of the very first things you do for hypertension is make sure you're taking your blood pressure at home with a fairly new automatic meter that's on your arm, and that you're relaxed, you're not sick, you're not stressed, you didn't drink coffee, you're not arguing with your spouse or your kids, and then just at rest. So blood pressure is when I'm chilled out, can my blood pressure go to normal, right? So most people get the blood pressure done at their doctor's office, and their doctor's office is the worst freaking place to get your blood pressure done because they wasted half your freaking day sitting in the jackass waiting room reading old ass magazines where sick people are all touching on all over them, right? And then they get you in there, and then they weigh you. That's a great idea, right? So they weigh you, and then you're like, that's not how much I weigh. And then your blood pressure goes up from that. And then they sit you in there, and you're either sick or injured or irritated. And they're like, let's see what your blood pressure is. And that is not real, okay? So blood pressure is at home. Unless that's what happens at home, too.
So don't take your blood pressure anywhere you're going to be stressed out.
Right. So
and also
sitting
with blood pressure too, you want multiple readings before you make some sort of some sort of declaration about having high blood pressure.
I think it's like 3 readings over 2 weeks. Not sick, not hurt, not injured.
Yeah.
So drinking water is the very first thing, because most people's hypertension is actually hypovolemic hypertension. So we drink all these diuretics, and then we can't compensate, so the body has to have less liquid, so that it tightens the pipes up to get the blood flow against gravity back to the brain.
Does it actually thicken your blood to be dehydrated?
No. Well, yeah, it does. Yeah. It's parts, it's like your hematocrit. It's parts per volume. And so, yeah, it doesn't really make the blood thicker necessarily, but it makes more parts with a little bit less volume. And so then that could be a problem.
Yeah. The viscosity, that still sounds.
Yeah.
Anyway.
And that's probably fair to say, too.
So hydrate. Important to hydrate.
So hydration is like one of the fastest ways to reverse heart disease. And Jenny says white coat syndrome. Exactly. And, even me going into the doctor's office once in a great while, when they take my blood pressure, I'm just like, okay, be calm down! Stop it! And then it's just like, your blood pressure's high. I'm like, damn it!
So one thing you can do is take some nice deep breaths.
Right.
Before they take your blood pressure.
Take some lavender, put in your hand.
Take nice deep breaths when they're taking your blood pressure.
Right.
Speaking of that, we have a question on blood pressure from Amy. She says her blood pressure is usually very low. What foods should she eat to raise her blood pressure to normal level? She feels like passing out the heat when bending over. She's been this way all her life.
So eat lots of processed food, lots of McDonald's, French fries. And then you have hypertension like everybody else.
That was the BS portion of the show.
So low blood pressure, really thin, kind of petite people, and then really high-end athletes or kind of marathoners or maybe runners will have normally really low blood pressures, even very low pulses.
Let me grab this. Sorry.
And so the risk ends up being, that kind of orthostatic hypotension, to where your body can't compensate quickly enough to create enough pressure to get the blood flow against gravity to the brain. So if you bend over, tie your shoes, stand up too fast, then you pass out and you bust your hip on the bathtub, and then they find you 3 weeks later with the cats eating you. So
that's your destiny, Amy.
You're going to be found months later with the cats. A bunch of fat cats.
I would give myself to my cats.
So they find rings in the litter box. So, my cats are watching. I do not give you me. No. Do your cats walk all over you in bed? Like the bed's lava, and so they have to actually walk on you, and they like step on your face and stuff?
Yeah, they walk over my boobs every night.
Mine too.
No, it's my hair that bugs me the most. When they walk on my hair, it drives me nuts.
Walk on your hair?
Yes.
I don't know. Something's wrong with my cats. I think they're trying to alpha me or something.
They're up at night. They just want to do whatever they want at night.
They're all just getting high on catnip. Like, let's mess with them. So, with low blood pressure, it's probably fairly normal, but drinking more water will tend to help with that. The other thing is you might need, it's a very difficult thing to treat because everything is treated on the other end of that. But, adding maybe just a little bit of coffee or yerba mate tea would be better, to where it gets a little bit of caffeine to stimulate a little bit more blood pressure to maybe, so you don't have the orthostatic part. That might be a good idea. And really what you're going to do, it's different from each person for the orthostatic hypotension for low blood pressure, is just kind of like keep a chart of like, when I do these things, like if I had yerba mate tea for a week, what's my symptoms like? Does it help it?
Would salt, a little extra salt help?
No, you just pee it out. See, that's the thing is, if you drink enough water, you can eat all the salt you want, you just pee it out, because that's how it's supposed to work. But if you're dehydrated and you eat a bunch of salt, like processed food, then you don't have enough extra fluid to pee it out. So what your body does is then try to pull into tissue. When it pulls it with tissue, it pulls water, and then you get edema. And so typically the cure for edema is drink more water, and then it'll flush that out, put it through the kidneys. You'll pee a whole bunch very quickly over the next few days, but then that's how your body gets rid of the edema. The other way is by moving, because all the veins to get the blood back up to the heart require muscle movement. So people that have edema, especially like coronary vascular disease, they'll end up with these tree trunk legs. They really have to move a lot more, but yet what they tend to do is move less.
Yeah, because they don't feel like moving.
Yeah.
They're not feeling good. So.
But 4 stalks of celery. 4 stalks. What's a stalk? Is that one? Like a celery thing has like a whole bunch of stalks, or is the whole thing's a stalk?
No, just one of the arms.
Is that why they call it vegetable
One of the
stalk?
branches.
Just one?
No,
okay.
just
So
one of the
4 of those.
4 stalks of celery.
4 stalks of celery have been shown to drop your blood pressure by 12 to 14 points. So not for Amy, but for me, if they have a little bit higher blood pressure. And we said like cholesterol, the number's bullcrap, right? That 200 is just a made up number. But blood pressure is real, except it's still, even up to like I have old charts, up to 180, still dietary, it's still lifestyle. 160 is lifestyle, 140 is lifestyle. But what's messed up is now they're making 130 to 139 high blood pressure just to get people on medication earlier. It's just nonsense. So onions and garlic lower blood pressure through prostaglandin A1 and prostaglandin E. And so onions, garlic, and celery is the base to soup. Right?
What?
Or kind of like mirepoix, right?
Sure.
You don't know what mirepoix is. Mirepoix is French fine dining, so...
So keep that to yourself so that
Oh,
no
that's a
one
bunch
can
of bull
learn anything new.
So mirepoix is when you... Now, I learned this from Chef Larcher, so it's not a big deal or anything. But he owned... did you ever go to that restaurant? Garden Grill Cafe? Anybody go to Garden Grill Cafe? Chef Larcher is the one that owned that. And so he was talking about mirepoix is diced up carrots, celery, onion, and even garlic. And you put that as the base of everything. So you warm your oil up first, then you put that in first, and then your herbs, and then your food. So if you're making steak, you do mirepoix. If you're making soup, you do mirepoix. If you're making spaghetti or whatever, mirepoix. Everything's mirepoix. So with mirepoix, you're basically getting the 3 ingredients that lower your blood pressure.
Okay.
Then we have mackerel. Mackerel by itself lowered it by 4 to 7 points according to the University of Cincinnati.
Who's eating mackerel?
I have canned mackerel in my cupboard.
Oh, I guess. And Jenny is too.
Yeah, me and Jenny knows what's up.
I'm not eating mackerel.
What?
But,
you know, the common people eat salmon. And this as well, mirepoix kind of people eat
hey, it is
mackerel.
a big step that I moved back towards fish. So,
well, mackerel is one of those high omega-3s, low mercury ones.
okay.
So, you got your mackerel and your mirepoix. And then the best fish for lowering blood pressure was wild-caught salmon, mackerel, herring, sardines, and tuna, but tuna with no name.
Anonymous tuna.
He who has no name. Right? So no albacore, white, no yellowfin, bluefin, purple fin, dolphin fin. So no tuna with a name. You just want that small kind of canned tuna.
Okay. Before we move on,
What?
let's address some of our comments.
I have a joke coming up.
You just keep that to yourself for the moment. So, thank you for your comments. They're hilarious. A couple of questions.
Yes.
Jenny wasn't totally clear last week on the dark line marks under nails. Does that mean heart valve damage? If so, how to repair? Oh, we didn't go into that.
I think I said it's Bose lines.
Bose lines.
I think they're Bose lines. So,
how do you spell that?
Beau. Yeah.
Beau, like pretty en français.
Oui.
Beau.
Je parle français toujours.
Beau, like beauty, but without the ty.
Nous allons chanter le Marseillaise pour Roger de Lyon.
Yeah.
Avec moi?
When you decide to do your show for France, then we can talk like that.
Ça, d'accord.
So do we not know very much about those lines?
So, well, and you know, again, I think you're on the right path, but reversing heart valve damage is probably going to be one of the harder things, but you would want it's scar tissue, so maybe proteolytic enzyme therapy. Sure, if we did a little research, you know, you'd have the nattokinase would be a great way to take care of that. And then, Carrie appreciates the French. But
no.
she's Australian, so then you got to do an Australian French accent.
No.
Good day, mate.
Ce n'est possible.
Ce n'est pas possible. Non.
Ce n'est pas
C'est
possible.
difficile.
Ce n'est pas possible.
Les Américains sont stupides. Les Français sont intelligents.
Okay,
All
those
right.
lines.
So, heart valve is probably going to be use proteolytic enzyme therapy, and that'll help break up scar tissue. But again, it would just be a shot in the dark as far as that, without looking really at the research for that. I haven't had to mess with that one yet.
Okay,
But
so
that's be the same for, like,
Bose
stenosis.
lines at least gives you something to kind of do a little research on, and something for also Dr. G to do a little research
Damn it, Jenny!
on.
I told you not to ask me questions I don't know on the air.
That's why you were unclear on that, Jenny, because we weren't sure.
Yeah, that's right. We gave you a half-ass answer last time. You still are asking questions.
Christine, why do I sometimes have very visible blue veins under skin on arms?
Because you're turning to the Hulk, man.
Thin-skinned?
Yeah, thin skin. So,
Turn it into the
you know,
Hulk.
they can... so sometimes that's normal. Like, I love it. Like, when women have, like the thin skin hair and you can see the veins. Like, that's so nurturing. Like, it seems nurturing. I don't know why. Or, like, on their hands, you can see the blue
That sounds
veins.
Freudian to me.
It looks nurturing. But,
Nurturing.
I don't know.
That comes from... There's some connection to breastfeeding there.
I think so.
Okay.
Yeah. But on the hands, too.
Okay.
So, so often it's the pigment in your skin. So if there's not enough pigment in the skin, then you're going to end up with likelihood to see those veins a little bit more. As you get older, sometimes if people have a little bit higher blood pressure or have a little bit of stagnation in blood flow, like they don't move enough, then they can get more what's called tortuous veins or like varicose types of veins, and then they'll start buckling and getting closer to the skin, and then of course they're going to appear darker
That's what
blue.
varicose veins are, is buckled veins?
Well, they're tortuous, yeah. So it's kind of like backflow, so that it just kind of like winds around. Like instead of having this long, it just starts getting longer.
Is it because the walls of the vein are
it's just
compromised?
It's just backflow, trying to handle all the extra pressure because they're not walking enough or they're sitting too much.
So should someone with varicose veins be more active?
Right.
It'll help a lot?
Oh, hell yeah.
That goes back to that skeletal muscle being a pumping of the blood back to the heart.
Right. And there are things that you can help. But typically it's going to be, I mean, if you want to build your veins up, it's typically vitamin C, which is fruits and vegetables and nuts and seeds and berries, legumes, greens, lots of variety of colors. But also like butcher's broom, what's the other one? Butcher's broom and butcher and the horse chestnut. So horse chestnut, and butcher's broom, which are typically in some type of vein formula at the health food store. Those are really good, but veins really become a problem when you start seeing little bruises, like just a little bang like that.
Easy bruising.
Yeah. Yeah. What I say, if I got a bruise and somebody asks me where it came from, I say, this is what you get for spilling paint in the garage at my house.
Yeah, I wasn't really paying attention.
All right, then fine. Next question.
Amy says she read online that chunk light tuna is the best rather than solid white albacore in a can.
Right, that's true.
Just an FYI if that is correct.
Yeah, so any tuna by name, albacore, is going to be more likely to have mercury or bioaccumulation just because they're bigger fish.
Okay.
So.
Okay. I think we're good to move forward.
Well, then Kendra said, can you do anything about varicose veins? And that's what we said. So butcher's broom, well, basically it's more water, more movement. And again, I don't know how many times I've probably said this a million times, but the average European walks 10,000 steps, the average New Yorker 5,000, the average Kansan 2,500. So again, it's not really exercise long term, but it's constant movement.
What about putting your feet up at night when you get home?
Yeah, I mean that's good, but you have to. Again, what we do is reactive medicine, which is, gosh, you sit all day, you're getting varicose veins, so let's just prop your legs up abnormally, so then your veins can drain to your heart because you won't walk.
Yeah, I mean that's more of a relief rather than that's more of a temporary cure.
Of course, there is a yoga pose that there's very encourageable to do for people every day. I saw a study about it.
There's probably more than one.
When you put your butt to the wall and your legs up.
That's legs lying up the wall.
Legs lying up the wall.
Also hero pose. Why
would that
modified
be
hero pose? That's not called hero pose. That's a separate pose.
What's the hero pose?
It's when you're kind of sitting on your legs a little bit. That will squeeze the blood out of the legs.
Oh, okay. I think that's how I sit with
Thunderbolt or hero pose.
Thunderbolt? That's totally going to be my position in yoga now.
So, I wonder too, though, if there aren't some people who are genetically predisposed to that, though, because there are people who are active who have varicose veins.
Oh, that's true. Yeah.
He's going to question me. I don't know if I can.
I took this picture of those cucumbers on the side of the road.
Yes.
Right? Did you see that?
I did.
There's like 10 cucumbers in like 10 feet. Like there's something going on, or somebody's messing with me. But I kicked them all together, and when I took the picture, you can see the veins like in my lower leg. And I was like, oh my god, I'm getting varicose veins, but I think I'm just getting thinner and healthier or something. I think it might be normal.
Okay.
So
let's move forward
to the research. So Harvard, don't want to brag, but Harvard, it's my Harvard tie. They said they did a study called an apple a day, and most people don't know an apple a day will keep the doctor away, but it really depends on how hard you throw it.
And scene.
Okay. I should do jazz hands.
Go ahead with the actual research?
Okay, so they did 31,000 middle-aged men, which soon that's going to be like 20-year-olds, and they did a low-fiber diet.
31,000, that's huge. Sorry. It's a a huge study.
That is a big study.
Okay.
So low fiber diet, 46% were more likely to have hypertension. And then they concluded that a fruit fiber has a strong antihypertensive effect. Antioxidants also increase prostacyclins that increase dilation of the blood vessels, like that. So, again, back to fruit. Lots and lots of fruit. Fruits, vegetables, nuts, seed, berry, legumes, greens. But that fruit fiber that you want. So not juice. Juice is going to cause hypertension, but fruit is going to lower blood pressure.
Right.
And then Harvard did another study with 90,000 nurses. If you thought
31,000 was big.
This is my joke.
I gotta have something to say in the show too.
All right, you do that.
No, go.
No, you do it.
No.
You do the 31.
It's you.
You're doing it again.
No.
You do that. If you thought 31 was all right.
Lori, hi Lori.
You
By the
can't-
way, hello everyone. I haven't said hi to anyone. Usually I do that. Anyway, Craig, hello.
I feel like she's purposely not saying hi just to spite some of you. If she did not say hi individually to you, she is smiting you.
It's personal. Sorry. Go on. 90,000 nurses.
You know, as a kid, you know how people like pray for individual people? I really thought I cut the corners by just saying, "Dear Lord, take care of everybody." Right?
Like you did that just because you didn't want to focus on anyone in particular?
No, because I wanted to help. I thought it was kind of like weird that people would just be like, "Screw everybody else, help my Aunt Betty."
Yeah.
But
yeah.
then I was just like, "Help everybody."
What made you think of that?
Something you said. Oh, about the saying hi to everybody.
Oh.
So so in my head there was this dialogue, and I was be like, "Well, I just say hi to everybody. Hi, y'all," right? And then you're individually saying people's names. So then all the people you leave out, then they're smited by you. But I was all inclusive.
Well, I'll try to say.
Hi, y'all.
It's more special when you use their name. Anyway.
If
Sorry.
you guys thought 31,000 was a big deal, like some people did, 90,000 in the next study.
Whoa.
90,000.
90.
That's like over double.
That's under double.
And these were nurses. 90,000 nurses through this Harvard study,
Okay.
eating 5 carrots a week.
5 carrots.
That's almost one per day.
Okay.
For 5 days. They had a 68% reduction in total stroke risk.
Just from carrots?
Just for eating 5 carrots in 1 week.
Can we?
Not 6.
Not
Only
4.
5 carrots.
I'm not big on carrots. Is anybody else big on carrots?
eat your
I have
apples. No,
never
you
been
eat-
big on carrots.
Carrots are awesome.
But I see beta carotene coming up next.
Mhm.
So
beta carotene prevents lipid peroxidation, which lipid peroxidation is the oxidation of healthy and fats that then cause some of the plaque deposition in the arteries.
So what are some other foods that are high in beta carotene? Anybody? Dr.
Yeah,
G.
you haven't been asking anybody questions.
You love carrots.
Kendra posted.
Carrots. You guys all like carrots. What's wrong with you?
Yeah, everybody loves carrots. Carrots are sweet.
Yeah, see, did you hear? Thank you, Julie. She says, Miss Fran from Romper Room said everyone's name. Well, I didn't really say everyone's name, but I really want to focus on that.
I can
She
just
could
see like
see
this.
us with her magic mirror.
Miss Fran from Romper Room. Romper, Stomper, Domper, Do.
So what are other... Wow.
Did they do Pinwheel in that? I freaking love
Pinwheel, that was different.
Pinwheel, turn it around.
I didn't have cable.
Nobody
I
had
had
cable
public
back
television.
in the 70s. I don't even think there was cable.
Beta carotene, other sources.
Oh, I don't know. What do you guys think? If I don't know it, I think we should ask you guys. Ooh, roasted carrots are really good. Yeah, Jenny knows what's up. So,
So beta carotene is in foods that are orange,
right. Oranges.
squash.
Squashes. Pumpkins. Ooh, this old pumpkin season's coming up.
Is it in tomatoes?
I think so.
Because it's that... We're just
I don't know.
Guessing.
This is the first show. I don't know stuff. You guys are asking questions I do not know.
All right.
Where do babies come from?
We like beta carotene.
So,
sweet potatoes. That's a good one.
Sweet potatoes. Yes.
Thank you. Okay.
All right. So beta carotene is a big one for lipid prostration. Beta carotene is also one of the most powerful things you can consume to make vitamin A to prevent you from getting sun damage, like the skin of
When
cancer.
you say lipid peroxidation, can you explain that to them?
So the oxidation of fats, which then makes them damaged and sticky and gooey and bad.
So we like that for avoiding that or preventing that.
You know what? That's an apple a day, right? That's 7 apples. This is only 5 carrots. If I'm like most patients, it's like, well, Dr. G, 5 apples or 7 apples and 5 carrots. What if I just did 4 apples and 3 carrots? That's how it is.
We should go on Sesame Street.
I post that.
Do you remember the oranges in the bowl?
I'm from the street.
And he would count them and go up the mountain and come back with, okay.
So then you had the University of Naples. Italiano. Amore povero bambina malata. So, 12-month study on high potassium-rich diets, like avocado. So this is 12 months, high potassium. So all they had to do was add extra food that was high potassium. And 81% cut their meds in half. 38 by the end were able to get rid of their meds altogether. And so high potassium foods like apricots, avocados, bananas, cantaloupe, honeydews, kiwis, oranges, potatoes, spinach, prunes, tomatoes, and squash.
Did you notice how many orange foods were in there?
Beta carotene foods too. Yeah.
Apricots, cantaloupe.
Yeah. So
squash.
they're lowering blood pressure and preventing clots.
Okay.
Food is medicine. And then green tea. So this study came out not too long ago. But green tea, 5 cups a day, little cups, or 1 probably a big gulp, cut heart disease in half in women.
What did? I was paying attention to Kendra's comment. She said she likes my facial expressions. It's the only reason she watches the show.
Oh, that's not cool. So,
bananas?
5 cups of green bananas. green tea.
Okay, sorry.
You guys realize we keep saying the same foods over and over, like it's not that complicated to reverse heart disease. Julie said nanners too. Yeah.
Okay.
So, green tea.
5 times a day?
Fruits and vegetables that are high in potassium. Carrots and apples are your biggest clot busters, along with mirepoix and fish.
Okay.
You put that all together, and I basically think we have the Mediterranean diet.
So, all right, some good information on clot busting. Do you guys have any questions?
So you should ask them if these are true or false.
Okay, we'll go through that next.
I like to boss you around. You're the boss. Mm-hmm.
I do whatever I want. I just decided to do that time.
Miss So-and-so on Romper Room would pay attention to people's names, so.
Okay, myth.
No, you're not supposed to tell them it's a myth.
No.
Yeah,
No. What? Oh, why did I say true or false? I was going to say myth or fact.
Okay. I'm sorry, I'm messing up your flow.
True or false? Myth or fact?
True.
I'd know if I had high blood pressure because there would be warning signs.
You guys got to answer these.
True or false? I'd know if I had high blood pressure because there would be warning signs.
I think because women know everything that they would. Is that true?
Kendra says true.
Ooh. But if you're a guy...
Ooh.
Amy says false. Fight!
Duke it out.
Fight!
Duke it out.
Julie says false. Oh my gosh. Kendra, it's not too late to change your answer.
So
scratch that
high
bubble out.
High blood pressure is called the silent killer.
Jenny was right.
Silent killer.
Yeah.
Okay.
My cousin was the silent killer.
Good job. The silent serial killer.
Well, he's deaf. He made a lot of noise.
We need to make a serial killer pun. Serial killer, get it? Get it.
So, my cousin was found dead like 5 years ago in his bathtub, and the weird thing is full of milk, and there was all this Captain Crunch cereal.
You are full of it.
And the cops were like, look, I'm sorry to tell you this, but it's been another serial killing. No, it's supposed to be Captain Crunch is found dead in a bathtub.
Oh, okay.
Filled with milk.
I'm sorry I let him into that.
Another serial killing.
Okay. Next one. True or false? Diabetes
True.
won't threaten my heart as long as I take my medication.
Ooh.
True or false?
Yeah.
Diabetes won't threaten my heart as long as I take my medication.
It's the diabetes.
I'm not going to say diabetes.
Won't beat us. That should be a thing. All right, while you guys are answering that, you know why they call it IHOP? It's called IHOP because I lost the other leg to diabetes.
It's awful.
The whole place is sugar.
Totally false. Totally false.
Aw, man.
You guys know that one. I need to find a harder one. How about this one? Heart disease runs in my family.
Because
so
no one in my family runs.
Oh.
Okay.
So there's nothing I can do to prevent it.
Oh, it runs in your family, so there's nothing you can do to prevent it.
True or false? Heart disease runs in your family, so there's nothing you can do to prevent it. False. That was too easy.
I think everything's genetic.
You guys are already very well educated.
You're just saying you're just making them all false. You gotta trick them every now and then. Trick them.
Well, then you throw one out. Because that takes creative thinking, and it's late for me.
Women are more likely to have heart attacks than men. True or false? Aww.
Fiction. I like that
Wait.
answer, fiction.
No, I don't, because then I have to figure out non-fiction is not
Fiction
made
means
up.
it's false.
Fiction's made. No, it's like inflammable.
So, heredity loads the gun, behavior pulls the trigger. Ooh.
Booyah! Who said that?
That's a good one. Jenny.
Jenny, that's good.
So they're saying true.
True. See how I mixed it up? How I threw in that monkey wrench? You see that?
Yeah, we kind of already told him we were going to do that, so.
Damn it!
Do you want to give the stat?
So now
Let's talk about it.
Oh.
We just researched this.
Not me, I knew it already.
There's a little caveat to this.
Ooh, I love caviar.
So, at a certain age,
Yeah.
women go beyond men. The risk is higher for women. They surpass men.
Yeah.
So, men, and it's after 60?
Yeah. So basically, postmenopausal women dramatically have a higher risk of heart disease. And does anybody know why that most likely is? Why a postmenopausal woman would have a higher risk of heart disease than a postmenopausal man? A menopausal man? Men go through menopause. Andropause. It has to do with the drug.
So while you are thinking about that, why is heart disease risk higher for women? Hormones.
Yeah. So synthetic hormone replacement therapy during the Women's Health Initiative was shown that it could increase the risk of heart disease up to 87% within the first year.
That is particularly for women who have flushing symptoms.
That's right.
But yes, if you have menopausal symptoms.
Yeah.
Okay, next one. True or false? I should avoid exercise after having a heart attack.
Oh, definitely true. Oh crap. That'll trick them.
True or false? Horse pee.
Horse. It is primary urine.
That's from
Premarin.
Yeah.
Yeah.
I should avoid exercise after having a heart attack. False, false, false.
Damn it.
Correct.
But what should they go by for determining exercise after a heart attack? You quoted this from one of our shows. What book? Or what guidelines?
The general exercise guidelines? I said that?
Yeah, it's you quoted. Was it the American something?
The ACSM and the American Heart Association recommend 150 minutes per week.
No, don't forget about the Heart Association.
ACSM.
What's
American College of Sports Medicine.
Boom, that's the one that makes the recommendations.
Yeah. Okay.
I think, is that right?
So our audience, a couple of people want to know about women's cardiac symptoms.
Oh, so that's good because it's non-traditional.
Non-traditional.
Mm-hmm.
Why? Because we're less predictable.
I think so. You know, this is not a good show. This is the third time.
It's watered down tonight a little bit.
All right, so
because women rock.
So yeah, I mean, basically, we're having to re-educate doctors for this, and I did not go through that education apparently, because women's symptoms tend to be different than men's. But I didn't read the rest of the article.
I've heard a sense of foreboding.
I'm foreboding. I grew up on a boat.
Here's the thing.
Are you gonna tell us some real stuff?
Here's the thing. If you're a woman and you're afraid that you are not going to know what your symptoms are for heart disease, probably best to go ahead and take some preventive measures. Go get yourself tested. Look at your family history. Look to see how many risk factors you have, and then start taking action based on that.
Yeah. So what's the symptoms for women? You give these lectures all the time.
I don't give the symptoms for women lectures all the time.
Booyah.
So I do know a sense of foreboding is one. Someone says,
what is foreboding?
Like a sense that something bad is going to happen.
Barnes and Nobling me over here. You know I'm Texas educated.
Exhaustion.
All right. Yeah.
You guys are schooling us.
Yeah. Yeah. I think that's right. So
why don't we come back with that answer next week?
That's a great idea.
So, we have about 10 minutes. I feel like, okay, how about this? A true or false? Now I'm going to lose it. One more true or false.
We should do one on memory.
Cholesterol.
Yeah. Oh, dietary cholesterol affects your cholesterol.
True or false? Dietary cholesterol is the same as blood cholesterol.
Dun dun dun. The way you asked it, I don't know. I feel like you're trying to play us for a fool.
False. Thank you.
Yeah, wait, every question you asked was false.
Well, we want them to learn. We don't want to just confuse people.
That's kind of what I go for.
I just want to keep it simple. There's enough information out there for people to be confused.
Okay, so as we wind this up, by the way, we got through all the research. 3 episodes and I finally got to say all the research. Finally.
Now you know what to do.
So, eat your damn carrots.
What is one thing you will take from these 3 shows that we have done on cardiac disease?
Yeah. What is one thing that you're going to start making changes dietarily or lifestyle since this?
Or 5, not 6 carrots.
And if you're a guy, you'll be like, I'm going to
try
only eat
mackerel.
4 carrots.
Yes.
Yeah, mackerel's good. Make mackerel like salmon cakes. Just make it with mackerel, but use brown rice flour.
Laugh. That's so important. We haven't talked about the fact that if we're not laughing, if we're stressing,
against laughing,
we can eat a candy bar or we can stress a candy bar.
That sounds legit.
I say that all the time now. We can eat a candy bar or we can stress we could stress ourselves into a heart attack.
That's right. You can literally think yourself dead through nocebo effect.
Yeah.
So the true cause, as you guys post those, I'm going to read these things again. But the true cause of heart disease is inflammation, not cholesterol.
Yes.
So low omega-3, which Amy talked about, which is fish and fruits and vegetables and what else?
Yeah, so we want to raise omega-3s. Tell them what to do and what not to do. Raise omega-3s.
Raise the omega-3s! Then you get to lower the insulin.
Bring it home.
Bring it down.
Bring it home.
I don't know.
Okay.
All right.
I'm really sorry.
I feel like we went off the rails.
Okay.
So, lower insulin by lowering blood sugar by stop eating crap and stressing all the time. Lower glucose by lowering blood sugar by lowering crap and stress all the time.
Stressing all the time.
Increase
vitamin D.
Right?
By how?
Oh, damn it.
Get
I wish
out
there was
in
some
that
way you could do that naturally.
Stinking sun.
Yeah. Get outside and pick those carrots.
Okay.
Lower homocysteine by raising methyl B12 by eating beans and greens and fermented foods like kombucha.
So lowering homocysteine means lowering inflammation.
Yeah.
Right?
True cardiovascular marker. Beans, greens, fermented foods. Raise potassium through fruits.
Bananas.
Avocados.
Okay.
That's it? We're not gonna
I don't know what you know the potassium foods.
Apricots was the first one.
Apricots.
I think that's the highest one. Squash, pumpkin.
Oh, yeah. Lots of orange things.
Orange things, yeah. Raise testosterone by stop exhausting your hormones.
So, yeah. Go ahead.
Lower estradiol by not taking hormone replacement therapy that's synthetic or exhausting your hormones, so it lowers progesterone, makes the estrogen dominance higher, and by easing up on the birth control maybe or something.
Yeah.
And less wordy.
Whoa.
And then raise nitrous oxide. I love that I can tell all the jokes I want. Can't get fired on my own show.
Raise nitrous oxide. Why?
How do you do that?
I'm asking you. I ask you first.
Going outside. So sunlight, arginine converts to nitrous oxide, which then stores in your tissue, and then when you go outside in the sunlight, it then releases nitrous oxide, your blood vessels dilate, and your blood pressure drops, and you feel happier and healthier. Raise HDLs, but how do we do that?
How do we raise HDLs?
Well, I'm asking you.
Well, there's several things. We want to keep triglycerides low, which means keep your glucose levels and excess calories. We don't want to overconsume. High triglycerides make your HDLs go low.
Oh, okay, yeah.
Okay, that's number 1.
3 ways.
Number 2, reduce trans fats. Number 3, eat good fats. Number 4, exercise.
You added some surprise Easter eggs in there.
All of those things will raise your HDL. If you just work on raising HDL, I feel like you'll solve all the other problems.
Right. Bus clots, raise HDL, you got it all figured out. Cardiovascular disease.
Okay.
Reduce oxidated LDLs or lipid peroxidation.
How to reduce?
Yeah. No, increase it. No, reduce it. Reduce
LDLs?
No, the oxidation. The lipid peroxidation.
I forget the ones that you mentioned. Apples and carrots.
Did you call me an apple?
I called you an apple.
So, antioxidants. Fruits, vegetables, nuts, seeds, berries, legumes, greens, lots of different colors. And then lowering triglycerides, which you just talked about.
Lowering triglycerides by making sure we're not overeating portions. We're eating until we're not hungry anymore. We're not eating until we're full or over full. And then we're also not getting a lot of excess calories, empty calories from sugar and refined carbohydrates. Do you know that you'll actually absorb more calories from refined foods than you will from whole foods? Because they're already processed for you.
So you absorb more than from whole foods, but what are natural grocers?
And next.
Decreased fibrinogen, which is fiber-rich foods, fruits and vegetables.
And that's for blood clotting.
Right.
Fibrinogen.
And then mirepoix. And then lower blood pressure by, unless you're Amy,
dancing.
You'll kill her. Right? Amy, if you do any of these things, you will die.
Lower blood pressure by reducing caffeine, stress, salt from processed foods, sugar from processed foods, hydrate.
Yeah.
Do we have anything else?
That's pretty dope. All right. We got through it all.
Oh my God, just hit the stop button, Holly. I know.
Wait a minute. Are you guys TALKING about me?
Yes.
Damn it. Well, okay, so we're going to finish. And then the next month or so, we're going to start talking about wise-minded. So we're going to kind of talk about some of the events that we're going to do. So we have the wise-minded women events coming up. And there's 4 in Wichita, and there's 1 in Newton. And the one in Newton's 2 weeks from now. And it looks like it's going to be at Prairie Harvest. But it's all day, so it starts out with yoga, like a very gentle yoga. And then we have a main speaker, Wendy. And then we have 3 more speakers. And then we have a final speaker, who is Mariah. Oh, I got that backwards. Wendy's finished, Mariah's starting. And then we end up on doing yoga at the end. Or sorry, meditation. I'm messing all up. Meditation at the end. And then we do wine and appetizers. And we'll have a couple meals in there too and snacks. But we have some really good, fun downtown activities. So this is kind of VIP, kind of women's event. Holly's speaking at one of these.
I think this is kind of sexist.
Why is that?
Because it's only women.
You know what you could do with white male pride? No. White male privilege? Vertically elevate other people. See?
That was a good answer.
So, it's a really great event. The first one that's coming up in Newton is September 15th on a Saturday, and it's all day. And the website is wisewomenict.com, and that has that event in there too. And so it's gonna be great. It's gonna be awesome. We're gonna have hopefully we're gonna have like a little kombucha tasting thing too. We'll have some kind of really interactive downtime activities that we encourage people to do, like the wall of invalidation for women. We're gonna have build your own woman out of all these different words. We're going to have video diaries, like soundboards for you guys to talk about your journeys. So for the most part, it's these basically real women with real stories in real lives of transformation, and kind of sharing their journeys to kind of help mentor other women in their journeys. And so it's a really fascinating thing. It's kind of just blown up from an idea that we actually started a long time ago. And it's just kind of really fostered and developed from that. So go to the website, and then if you guys have any like feedback too, let me know. And otherwise,
what do you guys want to know about for the next show? Please put that in.
Wise women
for the entire shows. I thought those were just promos.
Oh, we're gonna interview wise women though. So we're gonna be interviewing some of the speakers. So we're gonna talk about stuff about wise-minded women stuff.
Oh, we have not discussed that yet.
So if you have ideas of things that you would like to talk about with some of our speakers as we come on and have them kind of present them, let us know. So topics of like vertical elevation for women and Cosmo magazines and women's stuff, rights, stuff.
Okay. All right. Thank you for joining us,
That's it.
everyone.
All right. Love you guys.
It's always a lot of fun, and look forward to talking to you guys soon.
Yep. Don't touch that button. No, not that button right